I don't have to tell you that it's a very important broadcast that we have lined up today. Obviously, you're fully aware that Barack H.Obama declared a national health emergency Saturday dealing with the H1N1 flu. More than 3 months ago, we broke down the fact that this was the plan all along because there was no other way that they were going to be able to start mass inoculations with the H1N1 injectable vaccine without declaring an emergency because it was not tested. Repeat, it was not tested and it was not approved. It was not tested and it was not approved. And so they can only distribute the vaccine under an emergency. And yes, the executive orders signed by Bush, reauthorized by Obama, authorize mass quarantines, lockdowns of cities, total federalization of the country. Now, does that mean because he has authorized this emergency and regular law is suspended that they are going to have forced inoculations? No, it doesn't mean that. But when they declared level 6 flu pandemic in July, they had really declared it back in April, and we broke that news here in April. That loaded the gun, the martial law firearm that's pointed at our collective heads, was loaded. The magazine was loaded with live rounds. Now, let's image in our minds this whole pandemic martial law grid as a .45 APC handgun. So they loaded the clip and slammed it into the bottom handle of the firearm with the level 6 declaration. With his emergency declaration of Saturday, implementing the first stages of the level 6, the highest level of a health emergency. It is martial law. So they've green lighted. The Death Star is locked and loaded, ready to fire at the planet Aldrin. The .45 is loaded with the clip. Saturday, he pulled the slide back and let go, chambering a .45 round in the barrel. They have now removed the safety, and the federal government, controlled by the United Nations under level 6 rules, we're under UN control, and that is merging with the drive shaft of every sovereign nation through the federal government. So they're locked, they're loaded, they've got the gun to our head, and the finger is on the trigger for total, complete implementation of martial law. Martial law is in effect right now. That's like when a police officer turns his lights on. If you read the state codes, you are under arrest. You are detained. Now, he may let you go. He may not find something, some excuse. They even arrest you for not having insurance now or not having your seatbelt on. They promised they wouldn't, but they do. Unless you're an illegal alien, then they let you go on record. But that's another parable or analogy or example. So they've turned the lights on and they've pulled us over. The question is, will they try to continue on with their unconstitutional criminal takeover? That is the big $64 million question. We're going to go over all this news, and we're going to open the phones up to you specifically on the issue of the flu and the emergency. The toll-free number to join us is 1-800-259-9231. 1-800-259-9231 on this Monday, the 26th day of October, 2009. And the websites are Infowars.com and Prison Planet. Monday through Friday from 11 a.m. to 3 p.m. Central Standard Time, we are here live. Blasting out on the AM and FM dial, simulcasting on global shortwave, and, of course, the Internet. We have the Dallas County Department of Health and Human Services Office of Public Information Director, Zachary Thompson, on the line with us. I was watching Dallas television this weekend and saw him on the news giving reports about Dallasites, my hometown, concerned about there not being enough of the vaccine. All of this, of course, on the heels of President Barack Obama's announcement that it is a emergency. Sir, what does this mean by emergency? People are asking what this declared national emergency means.
Well, I think it's good that the president put together a national emergency. I think that is really focused on hospitals and the possible surge in patients that hospitals can see. So this declaration really focused more on hospitals and the impact of additional patients who may come in due to H1N1. My overall concern is enough vaccine in our community, Dallas County, North Texas, of course, Texas, and throughout the nation. We have to have the vaccine in place now, specifically for the uninsured, those who don't have a medical home. The concern is that we could see increased deaths. We could see, of course, additional outbreaks in our community. But right now, we're only operating with limited supply of the vaccine. So the real issue is vaccine availability. The federal government had promised that we would have vaccine available by the 1st of October. They did that. No one just told us it was going to be in such a small amount. So the real issue to date is that we do need the vaccine. We're concerned that we may get large shipments of the vaccine on the back end. And you can still use it in November. You can still use it in December. But one of the things that we want to push is getting the vaccine in place now, get our American public vaccinated before Thanksgiving so we can really deal with the issues of outbreaks of H1N1 throughout Texas, throughout the United States. So that's the bottom line. The national emergency is great. That's going to open up, various issues. I believe in Texas and most of our hospital emergency rooms in Texas, we've already been operating in terms of emergencies. If you looked at what you've seen even in Austin, Dallas, and Harris County, you've seen where your hospitals have basically set up tents outside their hospitals to deal with screening people out who were sick.
Well, you're the director of one of the biggest health departments in the nation, so perhaps you can give us the numbers. I see different statistics in the national media, but the regular flu kills around 36,000 people a year, if I'm correct. Correct me if I'm wrong.
That's correct.
And this flu has killed how many?
Well, locally, we've had 11 deaths in Dallas County. And then in terms of just Texas and throughout the nation, you saw a significant amount of deaths. So the concern is that here in Dallas County, we've had 11 deaths, predominantly among teenage kids, children, and that's a concern. So our concern nationally is that it has been a staggering number of deaths, and the concern is how much, deaths are we going to see associated with H1N1. We have to begin to get the vaccine out there to vaccinate our community to prevent future deaths. We don't know what the number may be in terms of H1N1. We clearly know about seasonal flu because we've been dealing with this for years, but this is a new virus, and what impact it's going to have, we don't know, but we do know you got to get the vaccine out there.
Sure, Mr. Thompson, my concern is the number we've got is around 5,000 deaths, and I understand that the season's, just now getting into full swing, but many experts and many headlines I read state that it looks like this flu isn't as deadly as the regular swine. That the swine flu isn't as deadly as the regular seasonal flu. So what is all the fear about? What is the big concern? What are the feds and other experts telling you the reason for so much concern is?
Well, you're right. That's a national number. I think no one is telling us. We're just basing it on the fact of the deaths we've seen here locally, and we realize the impact H1N1 is having on our community in Dallas County. This is not about a fear factor. Let me be real clear. This is about the fact that you have to put yourself in the place of a mother whose child has died from H1N1 or a child whose parent has died from H1N1, and you got to personalize it from the standpoint that this has been a deadly virus. We don't know what the number may get up to. We're seeing fluctuations throughout the United States. Basically, you see high number of cases in some parts of the United States, low numbers in other parts of the United States. Clearly, no one knows what to expect, but the preparation, we've asked for two things. One, prevention tips. cover your mouth when you cough or sneeze, stay at home when you're sick. But the key ingredient is in the vaccine. We don't know what the death toll may be if we continue without the vaccine. That's the real key right there. So I won't get into the debate whether or not this is any more different than seasonal flu. I'm just saying you've had people who have died from H1N1 related.
No, I understand. Yeah. Mr. Thompson, the director of the Dallas County Department of Health and Human Services, Office of Public Information, the issue here is we see these reports out of New York and out of Boston where they attempted to make medical workers and nurses take the shots. They've now lost in court. Dallas County isn't attempting to make medical workers take it, are they? Or what's the policy there?
No, and I think the question really on the table is whether or not, in terms of offering it to your public health workers, first responders,